Mankato and now at the University of Minnesota. And I know, like many of you parents out there, the decisions around our children are the most difficult. They're the most joyful. They can be the most heartbreaking. You can remember that first day when you dropped your little ones off at daycare, and the first time they were out of your sight since all those precious moments when you brought them home from the hospital, and how every hour of the day you were thinking and wondering how they are. But knowing that whoever you entrusted with those children needed to get it right, needed to make sure that that child's safety was first and foremost, and that their development was central to us. I can still remember, and as I think about this with school, those moments, those incredible moments of school. And I know last year we lost those. We lost that opportunity to walk across that stage to the cheering families and friends, part of those rites of passage that make community and society so joyful. We lost those opportunities to participate in extracurricular activities, those things that make life fun and that round out our character. And as we look to this fall, this is going to be, and I say this to someone who has been through many first days, it's going to be a first day of school unlike any we've seen. And I'm thinking back to my children's first days, because these are the days you remember. I can remember with my son Gus, he went to Bridges Elementary School in Mankato, and he was walking with his little hands and his new clothes that you had bought for him in his little backpack, and he was walking between my wife and I and holding our hands. And when you got to the school, to the front doors of the school, there was a little bridge built, and the symbolic nature of that little guy leaving his parents' hands, walking across the bridge and entering into school, the thing that binds us all together. We know how important this decision is. We know how included you as parents must be in this. And we know that you are counting on us, both us as state, us as your neighbors in your school districts and your school board, to take care of your children and do the right thing for them, both for their physical health, their mental health, and for their education, to make sure that we give them the tools necessary to survive and thrive and be the people they want to be. So this decision is many, many months in the making. It is hundreds of hours of stakeholder engagement with schools, with administrators, with teachers, with parents, with school boards, and it's hundreds of hours of engagement with public health professionals to understand what is the unique nature of a school. How can you keep a school safe? And with an understanding, not all schools look the same. Not all parts of our state look the same, and we need to take those considerations in. So to parents, my pledge to you is to surround and have the best people, the best minds, the best data to make sure that those localized decisions are being data driven in the best interest of your child. And to students who are out there, this is, we've asked so much of you. To last year's seniors who graduated, we're so incredibly proud of you, the way you stood in this moment, the way you showed us that in a time of uncertainty, our future still looks bright. You're out there volunteering, you're out there having your voices heard, you're out there engaging in society at a time when we're asking you to do things that no other classes had to do. No other classes had to give up their senior year proms, or had to give up the opportunity to a senior trip, or to play spring sports. As I said, many of you were poised to hoist those state championship trophies, and that opportunity was taken from you. Now we're going to start another school year, and it's going to be those first days of school things. And we know how badly you want to be back there with your peers. We know how badly you want to experience those things that make school so joyful. Yes, it's about learning, but those learning environments we all know happen best when there are human interactions taking place with you and your classmates and your instructors in that school community working together for you. And I also want to say to you that in this state, and you can see it by the way we think about our budgeting, the single largest budget item in the state of Minnesota is our students. It's about K-12 education. Because one thing is, every generation invests in the next, and we literally know you are our future. You are what Minnesota will be, can be. The country and the world is counting on us. It's Minnesotans who are the innovators. It's Minnesotans who are going to come up with the things that make this world a little better for all of us. So students, when we think about this decision, we're very, very clear about our goals. Your safety and the ability to get you into classrooms to learn and to have that experience, or to make sure that whatever learning model we use is the best for you and gets the most out of it. And to teachers, I want to speak directly to you. For those of you who maybe don't know, I have had many, many first days of school. I spent over 2 decades as a public school teacher. I started out teaching fourth grade at Wolf Creek Elementary on the Pine Ridge Reservation for a short time. I have taught everything from sixth grade to 12th grade. And I can tell you that there's no greater joy. When I introduce myself, I have the privilege of serving as the governor of Minnesota, but my peers and my profession is education and teaching. I know the magic that happens in that classroom. I know the things that you do, not just instruction, how important you are to those children, how important you are to those young adults, and how you help shape their lives. And I know those moments, those aha moments that happen in a classroom, that students understand those things. Those are the things that bring you the joy of why you got into this business. You didn't get into the business to talk just to a computer. You didn't get into this business to simply do public health. You got into this business to lift up minds and open up doors and have the opportunity to show what possibilities are. So our pledge to you is understanding this. We know that every single day you put yourself out there. We know that you're out there doing the work, getting things done. During this time when we asked you to retool in the middle of the year, you did it. We certainly know distant learning wasn't perfect, but that's not for the lack of effort from teachers. It's not for the work that was put into this. And we saw what the gaps that happened in that. And those gaps that were apparent before COVID-19 in terms of our inequities amongst our students, about access to electronic devices and the ability to connect to the internet in rural areas and areas where we don't have that. So I want to make sure that for you as teachers, our pledge to you is in this decision-making process is to make sure that we give you the tools necessary to deliver what you need to deliver in the safest, most effective manner and provide that joy to you. That's going to mean making sure that we're testing extensively in our schools and that you can feel safe to know when or if you have been exposed. And I know for many of you, especially young teachers, you'll find this out, those of you who taught, you spend your first 3 years teaching getting every cold and the flu that goes around. And then by about your fourth or fifth year, you have immunity. But COVID-19 is not the flu, and COVID-19 is not a cold. COVID-19 risks putting people at permanent damage or worse yet, fatalities from it. And so for teachers, our responsibility to you is to get you the testing, get you the PPE, and to the schools and the school districts to provide the resources necessary for you to make the changes that you're going to hear the experts recommend as we look at the long-term goal of getting our students back in the classroom. So today, we're going to announce the Safe Learning Plan. And as I said, this is a localized, data-driven approach to making sure that school districts, where it is physically possible to teach our students, we will do that. Where we use the data to drive that decision-making, but understanding that county-level health data has to be coupled with what the physical plant looks like in that building, what it looks like for your teachers, what are the ages of those teachers, what are the localized situation around COVID-19, and how do we build a planning matrix and a support system that allows us to move through a school year with an understanding we may move from different phases. We may be in classrooms, we may be out of them at certain times, but how do we make sure that the localized situation is being taken into consideration and that safety and learning environment is put forward? The state's responsibility is to use the best knowledge that we have, and we are blessed in Minnesota to have a wide variety of health experts who have been working with school districts, working with our partners at the Minnesota Department of Education to provide that matrix that helps make those decision-making possible, to make sure that when we're doing that, that local school guidance is coupled with the own expertise that are in those school districts, to support them in a manner that does those very simple things. And you'll hear these goals of keeping those students and that staff in that building safe, of understanding which is the best learning model to get the most out of our children, and the flexibility necessary to be able to build a system for the long haul. When this came upon us in February and March, and then decisions were made to come out of school, we were at the beginning of this. We didn't know as much about this. And we as a state and as a nation were unprepared with testing, with tracing, with isolation, and with personal protective equipment. Minnesotans have sacrificed and allow us to build up that stockpile. We have made changes that slow the spread. And last week we made one that if we adhere to it, will go a long ways to keeping these schools open and those children in that classroom. Wearing masks in enclosed spaces, trying to continue with social distancing and hand washing. So we've got the opportunity, and I want to be very clear to parents and to teachers. If going back into that classroom, if it's a decision that's made and it's on the best data, If your child has underlying health conditions, if you do, if there are extenuating circumstances where you feel that's not the appropriate way for your child to go back, they will be provided a learning opportunity that will allow you to distance learn. That is absolutely critical that parents will have that opportunity based on what is the best data that's out there, but based on that parent's decision that if they're uncomfortable with that, we still need to provide that education. So you're going to hear from the experts who helped plan this, and I can assure Minnesotans, hundreds of hours of work was put into this with hundreds of folks who are dedicated to this. I make note of this, and I told you a little bit about my teaching history. That's not necessarily because I believe you care, but we're all products of our past. This administration started out with Lieutenant Governor Flanagan and myself. Our mission statement was we wanted to make Minnesota the best state in the country for a child to live and grow up, Black, white, brown, or indigenous. We know there's gaps there. We know that we can do better, but that has not changed. It's one of the reasons why between myself and my wife, we come from families of teachers. All of our siblings teach. Lieutenant Governor was the youngest school board member in the third largest district in Minnesota and has worked in schools and worked with the Children's Defense Fund around what is best for our children her entire life. We are the only state in the country that has a public school teacher as a governor and also as the commissioner of education as a public school teacher and the deputy commissioner of education as school teachers who've worked in that. And they're not only teachers, as I started this out with, they're parents. They're parents who have their own children in schools. And I can tell you from our perspective, the education my son's getting and my daughter got in the Mankato public schools, my son is getting in the St. Paul public schools. I trust local officials with the guidance and the help we're going to give them to make the right decision, that if they deem that it's the right place for them to be back in that building, that's where our children will be. And so I want to assure Minnesotans, this is not easy. COVID is not easy. COVID does not care that it's July 30th. COVID does not care that we want to start school on September 8th. COVID does not care if the beds start being taken up by influenza come October. It will simply do what it's going to do. We need to use our best practices, the best epidemiological data, the best social distancing and mask wearing, and the best research to attack this, to make sure that that most precious to us, our children, are not negatively impacted by it. And that is the goal of this plan. And as I would say to you, it's not perfect. I wish there was a way that I could tell you, yep, this is going to happen. When people say open schools, that's not a plan, that's a slogan. We all believe we need to get our students back there, but you are owed the best plan with the best resources and the best communication amongst localized experts, state resources, and the best practices that are being deployed, not only here, but in other states and other countries around the world. So with that, it's my pleasure to introduce to you someone who's done, as I said, her professional life around children, but also the mom of a precocious 7-year-old, Lieutenant Governor Peggy Flanagan.
Thank you, Governor. Good afternoon, everyone. I don't think it is a secret that this decision we are announcing today was certainly one of the most difficult that we have made. It's an incredibly complicated decision to make, even just as a family. My 7-year-old daughter finished first grade this spring in St. Louis Park Public Schools. Like many families, we had good days and we had very challenging days when it came to distance learning. She missed her friends, she missed her teachers, she missed being in a classroom. I was working from home, trying to supervise her while juggling hours on the phone and in front of screens. It wasn't the best way for her to learn, especially as a first grader. But my daughter also has an underlying condition. It puts her at greater risk for severe symptoms of COVID-19 if she were exposed. Most Minnesota families are balancing similar concerns when making decisions for their kids this fall. There are parents who want their kids in schools, and there are parents who are not ready. There are teachers and staff who are incredibly limited or unable to do their jobs through distance learning, and teachers and staff who are afraid to return. There are students who are at high risk for severe symptoms or who live with family members who are, and they're students whose needs are not being met by distance learning this past spring. And some families are balancing all of the above. Our top priority is the health and safety of our students, our teachers, and the support staff who are part of their school communities. We also know that our kids learn best when they can be in a classroom. This is especially true when it comes to students from underserved communities, including Black students, Indigenous students, students of color, students without access to broadband, or those who have to share a computer with their family members, students with disabilities, low-income students, English language learners, and so many more. That's why we're working in partnership with our departments of health and education to set the guidance for how much a school can reopen. The Safe Learning Plan is thoughtful, nuanced. It's an approach that allows us to take into account those competing concerns, along with regional differences in the spread of COVID-19. School districts and charter schools will be in one of three models: in-person, distance learning, or a hybrid of the two. And this will all be based on local data of viral activity in their region. And the model used may shift based on how the pandemic shifts over time. What's especially important is that schools can make the decision to implement a more restrictive model if they decide to do so. Families with concerns can opt into distance learning, even if their district reopens. And teachers and staff must have the option to work remotely. Distance learning was not perfect, and this new plan won't be perfect either. We are relying on the expertise of our public health teams, the compassion of our educators, and the commitment of our communities to make this work. Our littlest Minnesotans are depending on us. And with that, I'll introduce Commissioner Jan Malcolm. Thank you.
Thank you, Lieutenant Governor. Good afternoon, Minnesota. Well, as the governor and lieutenant governor have said, this is one of the most consequential and important and difficult decisions that we have had to make as an administration. I am extremely proud of the hard work that's gone into creating a plan that we believe is based on the absolute best evidence we have today, with, on the one hand, the science of understanding the virus combined with the science of how to fight the virus in a way, and putting these things together in a flexible format and approach that is meant to support local decision makers with not only the best evidence that we have, but a close consultative partnership to help them translate this framework into decisions that are the best for their students and their communities. As the governor has said, we have a great deal of respect for the fact that conditions are different around the state, and that there's such a rich diversity of learning environments across the state, and that local educators and leaders know and have been incredibly adaptive throughout these last months to change, to try to meet the challenges of educating with this virus, and doing so in ways that really reflect what their communities need. So as the governor has said, unfortunately, and boy, we all wish this was different, COVID-19 is not going away anytime soon. It is still very much with us. We are still in the growth phase of this pandemic, but we also can't stop attending to the learning needs of Minnesota kids during a pandemic. The pandemic is not going to pause for that, but the objective of helping our students to learn is also an equally urgent priority. So it's my opportunity today, my job, to tell you a little bit more about what the governor and the lieutenant governor have already outlined in terms of, first of all, the goals. As we said about trying to build the best evidence-based plan that we could, we wanted to start with an articulation of what goals should drive this. As the governor has said, the first goal was to prioritize the safety of students and staff. And as the lieutenant governor has said, to prioritize in-person learning, particularly for younger learners and those with the most need for in-person instruction. We recognize the inequities that exist in differential access to supports and resources that make distance learning easier for some and harder for some, and the important emotional developmental aspects that come with in-person learning. We also knew how critical it was to recognize the differences in potential spread among different ages. And here's an example of how this virus keeps you humble. It was literally about a week ago when we got new data out of a very well done study in South Korea that made it more clear, abundantly clear, that for older kids in the school system, particularly those between 15 and 29, their ability to spread the virus actually looks a lot more like adults compared to younger kids, particularly those under 10, where their ability to transmit the virus is very much lower. So when we talk about kids not being at risk for severe disease themselves or not being transmitters of the virus, we need to be more specific about the fact that that differs in some important ways by age group. So as we built this framework, it was important to us to build it around that knowledge. Next, it's critical that we support localized planning by giving not just general platitudes, but a framework that's quite specific and based on the best evidence as we know it today. A framework that gives clear guideposts, gives clear recommendations, gives clear direction for the things that local decision makers need to take into account. But to support them in that effort, this is going to be a highly consultative model. It's not just posting the guidance today and leaving that decision entirely to them. As you'll hear from our education colleagues, there will be a really quite detailed consultative process and resources available to each local district and school to understand how to apply and adapt this framework for their community's needs. And again, as the Lieutenant Governor mentioned, it all really begins by acknowledging the reality that the disease prevalence looks different from community to community. While it is a shared challenge for all of us in Minnesota, these localized school planning decisions need to be grounded in the fact that the virus is at different stages and different levels in our communities. So this next graphic just sort of lays out the steps in this process of localized decision making. How do schools determine the learning model that they're going to use? And again, as I think the Lieutenant Governor mentioned, this is intended to be a flexible approach that schools and school districts will use and adapt throughout the year. It's not wherever you start is where you stay. The virus will continue to evolve, and so will these plans. So at the first step of this process and this model, the health department has used data from counties and created a framework that I will show you in a minute that determines really a starting point for this conversation. It determines a recommended base learning model depending on the level of virus in an area and the age group of the students that will differ from age to age. The Minnesota Department of Education will share not only this county level data, but also the consultative process that will be available to schools to engage with education and public health experts to review their data, to go deeper inside some of the underlying causes of what you see just in the data itself, and to review what capabilities exist in the school's preparedness plans to mitigate risk. Third, the public schools and each of them has an incident command team already in place, and will use that structure to evaluate their ability to implement the required and recommended health best practices that are contained and have been contained in the guidance around planning for these 3 different models since June. The public schools, in consultation with public health, then will determine the learning model to begin the school year. And they will be the ones to make that decision and communicate that decision with their local school community. But as Lieutenant Governor importantly called out, regardless of the learning model chosen by the school district, all public schools must offer an equitable distance learning option to all families. And finally, after the opening model is chosen, public schools, with support from local and state public health, will continue to monitor the school and community level impact of COVID-19 on an ongoing basis and to adjust the learning model itself if that is needed. So just a quick graphic here to just explain where this localized data comes from. So this is based off of a 14-day county level rate of new cases. So the total number of cases that has been seen at the county level in the last 14 days divided by the county population as a ratio of county population per 10,000 gives you a 14-day county level case rate per 10,000. Some of you may be aware that we've been reporting county level data on our website for some time. We're using a 14-day measure here as a way to create a little more stability in the data and enable a little bit of a historical perspective so that again, critical point here is that this is the starting point for the conversation. This number does not by itself dictate what learning model a school district or a school will choose. So here's the framework. Here are the parameters that we within public health have developed. And I just want to say just how much, and the governor acknowledged this, how much work has gone on among our staff at the Minnesota Department of Health to research everything that we can know. And they have poured over the months of epidemiologic data we have in our own Minnesota population, have with me as a resource today. And I want to just take this opportunity to thank her. Susan Clammer is our lead epidemiologist who's been working on these school issues along with childcare issues. And Susan and her team have personally, literally investigated every single case that has emerged in the Minnesota population among our school-aged kids. And they have just done an incredible job consulting with national experts, poring over the data, looking for different ways of coming at these risk categorizations. We've also had the benefit of consulting literally up until last night with national experts not only at the Centers for Disease Control, National Institutes of Health, but Dr. Micah Osterholm, who many of you know, has been deeply involved in these discussions of an approach, an epidemiologically based approach to a safe learning model. And Dr. Osterholm has spent really a large number of hours sharing with us also the benefit of his conversations and knowledge with international and national leaders. So I want to thank Mike for being a part of our team as well. So this is how it looks. So you start, and again, starting the conversation with this framework. This is not, again, a formula that says if your number is here and your score is here, this is automatically what happens. But this is a recommendation. This is what, to the best of our knowledge of the data today, this is where we think our guidance to a school district to say, here's where you should start this conversation. So if, for instance, you have 0 to 9 new cases per 10,000 in your county over the last 14 days, you would be the recommended learning model for that situation would be in-person learning for all students. That would indicate a low level of viral transmission and an environment in which in-person learning for all students would be optimal. As the governor and lieutenant governor have said, that is certainly the goal, to get as many kids back into in-person learning as can be done in a safe manner, based on what we know about the risk of transmission and based upon the availability of best practices to mitigate the risk. So it goes from 0 to 9 cases per 10,000 over 14 days, leading you to in-person learning for all students. And you can see on the chart how that progresses then. 10 to 19 cases, the learning model recommended would be in-person learning for elementary students and hybrid learning for secondary students, reflecting that priority on in-person learning for the youngest learners and those with additional particular needs for in-person learning. Between 20 and 29 new cases per 10,000, you'd be looking at a recommendation for hybrid learning for all students, 30 to 49, hybrid learning for elementary students, distance learning for secondary students, and above 50, and there's pretty good national consensus that 50 cases per 10,000 over this 14-day period would indicate a level of significant enough community-wide transmission that the recommendation there would be distance learning for all students at all age levels. So again, that's kind of where the conversation starts. Here's your data. here's the tier that you fall into based on our best thinking around different risk levels for different groups. But then the next step is, what kind of plans do you have in place to be able to manage the risk? And these recommendations and requirements have been out for some time. So if a school is doing in-person learning or hybrid learning, there are a number of things that are required that they have in their preparedness plan. The masking policy, use of masks, gloves, gowns when needed, depending upon the type of interaction with the students. Building routines of hygiene and education, daily cleaning, the ability to frequently clean high-touch surfaces, having a building level COVID-19 coordinator who's got eyes on what's happening on the ground on a daily basis, limiting non-essential visitors, and doing monitoring and excluding for illness. Some of the things that have really worked very well in the summer programming and in the childcare settings that we've now had experience with over a number of months. And what would be required in hybrid learning would be social distancing of 6 feet at all times in the school buildings. In the in-person learning, the recommendation and the requirement is distance learning, social distance wherever that is possible. In classrooms, as much distance as is practical. So it's not a hard and fast 6-foot rule for in-person learning in classrooms. But there are requirements and recommendations for how to cohort kids, how to minimize sort of mixing of different groups of kids. And in the hybrid learning environment, there are some specific capacity restrictions, for example, as you see, school facilities at 50% capacity, as well as transportation, and sufficient staffing levels to meet the requirements of this more restrictive model. So again, there's quite a bit of detailed guidance out there in terms of how a school district would assess its practices against this list of recommendations, in some cases around best practices, and requirements in some cases based on the learning model. So that's the decision-making process in close consultation, and I think our education colleagues will talk more about the consultative process. But after the decision to open is made, that's not the end of the conversation. There'll be ongoing evaluation and ongoing consultation about what's happening with the virus transmission and with the school's ability to continue to build up these mitigation and best practices, and what's going on in the community around adoption of some of the mitigation strategies that we know are so very important. And as the governor mentioned, I think in his opening comments, we know with the level of viral transmission that exists in Minnesota and around the country, we know that there will be cases of COVID in our schools. And the key will be how well can we identify that, assess that, and control that right away. So once there are cases determined, then there'll be a whole series of consultation and assessment and assistance to keep that from becoming something that gets out of control in a school setting. And I won't take any more time going through the specifics here, but just we'll refer you to the guidance that's been posted this afternoon, which contains a great deal more of this level of detailed information. I want to, at this point, turn it over to my colleague and National Board Certified Teacher, our Commissioner of Education, Commissioner Mary Catherine Ricker.
Thank you, Commissioner Malcolm. This spring, our educators had 8 days to reinvent the way they met the needs of students. As a teacher myself, and as the governor knows from his time in the classroom, educators are natural innovators. We know our educators and schools worked hard to reach students using new formats. Not only because they shared their stories with us about doing that, but because we worked side by side with them, creating guidance in real time to share information about what was working and what was not, with schools across the state. Since then, like the reflective practitioners we are, we have been listening, learning, and improving our guidance. We have all been learning together. We have not just been learning from our schools and educators. We actively listened to our families and our students. We've heard, and all of us up here have experienced ourselves, that distance learning was challenging and frustrating. And it was especially difficult for our communities of color, our Indigenous communities, our rural communities, and our low-income communities. It was a transformation on a scale that had never been experienced or attempted before. And this spring, Minnesota got to see up close what our school communities have known all along. And that is that school buildings are not just academic education places. They are where students make lifelong friendships, where they join teams or try new things, and where they test boundaries. School is a place where relationships matter. And for some students, our school buildings may have been the place where they felt safe, or may have been the place where they received a meal they could count on, because school is a place where support matters. Additionally, we know each school community is beautifully different, with its own unique set of strengths and challenges. Knowing this, and with the voices of our educators and school leaders, students and families clearly on our minds, in perhaps the most ambitious group project any of us have ever attempted, we and our partners at the Minnesota Department of Health and the Governor's Office created Minnesota's Safe Learning Plan. This plan is an approach that is localized and data-driven and grounded in science. It allows schools to build on their strengths, receive critical health information they need from our experts, along with the guidance they will get from our department. This plan prioritizes safe teaching and learning environments for all our students and staff, and gives our families the option to choose an equitable distance learning experience if that is what works best for them. This plan focuses on the science of knowing where the virus is and what it is doing in our counties, partnered alongside the science of what we know how to fight this virus and to keep our schools healthy. Our schools have been working tirelessly to meet the challenges of this new way of teaching and learning, to learn from our mistakes, to capitalize on our successes, and improve the work we have done to meet the needs of all of our students. We have gotten used to expecting the unexpected. And at the Minnesota Department of Education, we are committed to be alongside our school communities, as we have been, to help them through anything this entire school year may bring. It is my absolute privilege to take time now to turn this over to my partner at the Minnesota Department of Education and my fellow practitioner, Deputy Commissioner Dr. Heather Mueller, who will provide details about the supports that come with Minnesota's Safe Learning Plan and how our state will work together with our school districts and charter schools in their work to meet the needs of every student. Thank you so much, Dr. Mueller.
Thank you, Commissioner Ricker. Thank you, Commissioner Malcolm. Good afternoon, everyone, and thank you for giving us the opportunity to speak with you today. As the governor outlined, I think one of the most important theses that we wanted to address first is that this is a deeply personal decision. We recognize that the education and health of our students and our families is of utmost importance. And quite frankly, as we pair those two together, that is something that we've always done in our schools and in our education systems. We've always expected that our schools are safe. And when there are times when our schools have not, we've come together and we've rallied around that. But we've also known that that is a place where they have their needs met, their social emotional needs, their health and wellness, and we're making sure that they continue to feel safe. And we're also being very thoughtful about the high quality education we've come to expect in the Department of Education and throughout the state in education in general. And when those two pieces are colliding with COVID-19 and with our expectations around education, we are very thoughtful as parents about what that means. And as a governor and the commissioner alluded to, I too am a parent. I'm an educator. I've been an educator for over 25 years. And I recognize that as I think about these decisions and I think about my own families, I think about the fact that we can't only do that for what I think about for my families, but we're thinking about this on behalf of our state. And so as we thought through this process in our partnership with the Department of Health, to which we are truly grateful, the work of Commissioner Malcolm, the work of Susan and her team has been incredibly important because it gave us a place for foundation. It gave us a scientific place to start and gave us the opportunity to think about, once we have the opportunity to think about where we want our students and how it is we can support our staff, what do we need to know next? Having that base learning model is a start, but we also know that we need the resources to be able to be thoughtful about what we'd like to do next. As a result, it's not moving. This is just one example of why we're coming together. Yeah, it's okay. So, okay, I'm just going to grab one. So as we think about our supports for schools, we think about a couple of things. First and foremost, we think about our regional support teams, places that we can bring together a group of people who are going to work with our school superintendents and charter school leaders to be thoughtful about not only what they need to be doing to support their school communities and their communities in general, like they do every single day of a school year, but also the added components of COVID-19 and how we can be thoughtful about that. We also know that what identifies our strengths and weaknesses and where we know what we value is where we put our time, where we put our human resources, and where we put our monetary resources. So we're going to talk to you a little bit about today about some of that funding as well. Also, the governor last week talked about face coverings and expected that as a mitigation strategy for our schools and for our communities. And so we're going to talk about what that means and how we're going to be able to support our school districts and charter schools in that mitigation strategy to continue to promote the safety and health and wellness of our students and staff. And finally, in the comprehensive components around testing, we know that once we get our students and staff back into our buildings, if that is the base model that is expected and supported, then we have the opportunity to really be thoughtful about how it is that we can support our staff and students in that testing. So first, I'd like to talk a little bit about where it is we're putting our human resources and our capital. We recognize that our superintendents and our charter school leaders run an entire school district and community. And we recognize the importance around that comes from being able to support the academic, social, emotional, health, safety, and wellness of our students, as well as their mental health and nutritional needs. While we have a COVID-19 pandemic, we also need to be thoughtful about how is it that we are going to continue to promote that work and the health and public health support that we need. So we have developed a regional team, a support team that is inclusive of the Minnesota Department of Education, the Minnesota Department of Health, our regional service cooperatives, and our local public health officials. That gives us the opportunity to, for example, if there is a case in a school or a school district, the superintendent would contact the regional service cooperative, and they would say, essentially, we have a case or a confirmed case in our building, what should we do next? That person would then be able to work with their local health official. The service cooperative person would work with our local health officials, as well as the Minnesota Department of Health, while the superintendent can turn back to what they need to focus on, and that is their school community, communications with families, continuing to support the academic needs and all of the other pieces they're doing. So while that superintendent is helping to do that work that they do, then our regional support team members will be coming together and thinking about What does that mean for a school? What does that mean for the school district? How would we be able to ensure that we can do contact tracing? They would come up with that plan and be able to come back and work with that superintendent in partnership. That goes back to that consultative model that we've talked quite a bit about, quite frankly. When we're talking about the beginning and looking at the science, at no point in time are we saying that superintendents or charter school leaders are on their own in these decisions. It gives us the opportunity to really have a partner in this work, and we're not going to stop there. So once we have our regional teams up and running, then we will have the opportunity then to focus in and then come back in and support those when and if there is a case of COVID in their school community. We also are thoughtful about the funding. Once that we've identified what that human capacity and support is, it's really also being thoughtful about where are we going to put our monetary resources, because our monetary resources are also an indication of value. And the governor and the lieutenant governor have been very clear in this. Since we have started with COVID, we have supported our schools and our K-12 education programming with a recommendation of over $430 million in supports. The first of that came with $38 million that were identified for K-12 schools in our GEARS funding. Those funds were identified for three basic things. The first was to focus on technology. We know that there is a digital divide, not only within our metro communities, but geographically within greater Minnesota. We know that not only do we not have devices, that we don't have access to internet. And so one of the things that was prioritized with those dollars was the acquisition of digital devices to close the digital divide for our students and to ensure that we have a model that could exist beyond a brick and mortar setting if needed. We also identified in those GEARS dollars that we would need a staffing support, specifically this summer, to be really thoughtful about how it is we are going to continue to accelerate our learners. And we're really purposeful about the way that we're talking about the acceleration of our learners, because we do not want to put learning loss on the backs of our students. COVID is not their fault. COVID is something that has happened, and it is a societal response. And so we are talking about not from a deficit base, but also from a strength base. And we recognize that we have the opportunity to accelerate learning, and GEARS dollars were identified to be able to help to do that, as well as recognizing that we wanted to have the opportunity for 0 to 8-year-old students to have on our littlest learners in Minnesota to have the opportunity to have some enrichments throughout the summer. So those are three priorities that were identified with that $38 million. In addition, our school districts have had the opportunity to utilize $140 million in ESSER funds. Again, we identified some priorities within that. The first priority was specifically to look at technology. If you were not able to close the digital divide with the GEARS dollars that were assigned and allocated to you, now you can also use your ESSER funds to be able to shore that up. The second piece that I prioritized within the ESSER funds was staffing. How are you going to be able to staff up your buildings and your schools so that you have what you need to be able to support your students and your staff and your families? And the third piece is around mental health. And that's something that was really important for us to talk about, simply because we know that the impacts of COVID and the change in routine for students has caused a lot of stress, not only on our students, but also our families. And we wanted to ensure that as we were thinking about models that were supportive of our students, that was one of the things that we were prioritizing. And finally, we are requesting additional funding for a coronavirus relief fund in the amount of $250 million for two specific areas. The first is in operational costs, and the second is in students and staff and family support. When we think about operational costs, we think not only did we use that base information in the science that the Department of Health has helped to provide as a place to start when thinking about our learning scenarios, but it also is giving us the thinking of how are we going to get back into the building? What else do we need to think about that we haven't been able to budget for before? We're having to clean in ways that we have never had to do before. Our schools haven't been able to budget for that, and they don't have the funding for that. We are going to be transporting differently than we ever have before in a hybrid model. We have to be able to think about that differently, and we have to provide funds to be able to do that. Protective equipment, thinking about how it is that we can support our close proximity adults who are working with students who are medically fragile, and how it is we have protective equipment and supporting that. Cleaning our buses, and those pieces are pieces we need to be thoughtful about. The other piece that we thought about is our support for our students and families. We know that once you get them into the buildings, there's so much more that goes beyond just the operations of a school. It's everything else. So we're thinking about how is it that we can increase translation materials, which is something that became apparent from from our community outreach and hearing from our education partners and our families that we need to be able to do differently and we need to be able to do better. We need to be able to be thoughtful about how is it that we are going to continue to be able to support the mental health and social emotional learning of our students. How are we going to be able to continue to grow technology and devices if you still were not able to finish shoring up that digital divide? And how is it that we'd be able to provide tutors? And so that request has been set forward to the governor, and we have their full support in that. We're very thankful for being able to identify that funding. The other thing that I didn't identify that came out of that was probably the face coverings, right? There was no clear articulation of that. And that is because we have already identified that when the governor and the lieutenant governor announced their executive order that stated that all students, staff, and others present in school buildings and district offices or riding on school transportation vehicles were required to wear face masks and coverings, we recognized that that then also meant that it became as important as a pencil or a pen or paper or a device in the building. So our cross-agency efforts has led us to have the opportunity under the governor and lieutenant governor's direction to provide face masks for every K-12 student and adult in the educational settings. So every single student in K-12 will have a one cloth face mask. Every teacher and all staff members in our K-12 system throughout the state will have one cloth face mask. Every single school will also receive 3 disposable face masks per student. And that's because, quite frankly, a lot of us might forget them. And we never want a face mask to be a reason that a student isn't able to come into the building. And we know that we would be able to provide them for them. And it's not only going to be a student, we're going to have some of our grown-ups that also, quite frankly, forget them, right? As you're running out the door, you might forget your mask. So you want to make sure you have that. And then the final thing, quite frankly, is every school will receive face shields, because one of the things we also know is that for our youngest learners, face masks may not be appropriate developmentally for their adults. When they are interacting with teachers, we need to be able to see their faces, be able to see their facial reactions. We need to see smiles, and it's developmentally appropriate. We also have students and staff who are deaf and hard of hearing, and we want to be respectful of the need to be able to read lips. And so face shields are important. So in addition to every single teacher and adult in the throughout the state in K-12 receiving a cloth face mask, every teacher will have a clear face shield, and 50% of our non-licensed staff will also have a clear face shield, because we know that that is incredibly important. The final thing that I think is important to talk about is testing, right? We've talked about where it is we're going to put our human capacity and resources. We've talked about where it is we've identified funds, and that it helps to articulate what we value. We've talked about the important role of face masks and the mitigation efforts that does, not only throughout our community, throughout the state, but specifically in our school communities. But if and or when there is a case of COVID in a school, whether that comes through a student or it comes through an adult, we know that it is incredibly important for our staff members and our students to have access to testing. So the first thing that the governor and lieutenant governor asked us to do was to figure out how it is that we could ensure that every educator and all staff members throughout our public education K-12 settings would have the availability for a test at no cost. And so we have identified a process where there is a saliva test that every single educator throughout the state of Minnesota will have a saliva test that is for them. They will have one. Because if there is a point in time where they realize that there is a student who is sick in their classroom, or they're not feeling well, and they may not be immediately able to get in, we got to give them the peace of mind that they would have the opportunity to take that test. They would essentially do a saliva test. They would seal that up. They would send it off, and within 24 to 48 hours, they would have the response. And with that response also comes peace of mind. And that's something that's incredibly important. The commissioner talked a little bit about how important it is for our staff and our students to also know that their safety and their health and wellness is at the center of every decision that this administration has made around our efforts to move forward with the K-12 education system in the fall. In addition, the Department of Health has given guidance prioritizing for our educators and for our school staff members that they are testing and they are prioritized within the testing. And so that means that they will, if there is a case for exposure, whether they are symptomatic or asymptomatic, that means that they have also been identified as critical workers who have the opportunity to be tested and prioritized within that. And we really appreciate the guidance that the Department of Health has given in that, because we also know that that is another place that's a peace of mind for our students and staff and our families. And then finally, We also know that there may come a time where the Commissioner of Health, Commissioner Malcolm, talked a little bit about that it is possible that there would be 50 plus cases. If that were a case in a community or in a school community, then it might warrant a testing event. And as such, we again have identified specific individuals who are going to be able to, from the state agencies, coordinate those events within our school communities, because we know that our superintendents and our charter school leaders and our community leaders are busy leading in their communities. And we want to give them the opportunity to continue to lead while we support them in their efforts. And so we will also be using a testing event. And finally, what that kind of goes along with the testing is there are a couple of different things to think about. Is this possible that if a student or a staff member is feeling ill, or it needs to go in, or there has been somebody who has already been tested, then our local provider testing, when possible, is there to ensure continuity of care for students and staff with state assistance, and will coordinate that with them and their local health, public health officials as needed. It also means that our state will supplement local resources with staffing, lab capacity, logistics, and results in other assistance, because we know how important this one particular factor is in our education. And then, if appropriate, we would move toward a universal and consider universal testing if that is warranted. I think that in the end, what this kind of gives us the opportunity to say is, beginning with what Commissioner Malcolm talked about with the science, and on one side of the equation is really being thoughtful about what our county health data is telling us. The other side of the equation, where we're talking about all of the health guidelines that our school districts have been working toward since June, since we were able as Department of Education to put forward the 100-page documents laying out the 3 different scenarios and articulating what they needed to include. Health was at the forefront, because that continues to be the center of our work. And then finally, this third piece really gives us the opportunity to talk about the support. How are we going to help our school districts and our charter schools as we are coming back into the building and thinking about what that education system looks like? And so we really appreciate the efforts of our Department of Health with our agency-wide colleagues, the governor and the lieutenant governor, and their support in recognizing the important role that education plays in our students' lives. And with that, I'll hand it back to the governor.
Thank you, Dr. Mueller. Thank you for modeling changing on the fly. When technology doesn't work, we move on. If COVID's taught us anything, it's not going to work the way you want it to. And when it comes to education, we have to build in redundancies. We have to build in a depth of thought. And this just scratched the surface of the work that went into this and the partnership that went into this. Before we take some questions, I would just ask Minnesotans, all of this work, the one thing that each and every one of you can do to give that incredible gift of as normal of a public school and an education as possible to our children is do the simple things of wearing the mask and social distance and wash your hands. There's numerous ways to express your disdain or your anger at certain things. Public health is not the best place to do that. And we've got a plan. We've got the capacity. We can do that. Each and every one of you can do so much as Minnesotans out there to make this work. This plan alone won't work if community spread accelerates. This plan won't work if people choose to gather in large groups, and we get it if it's asymptomatic. And what that will end up doing is it will end up impacting our children. And again, it's not their fault. COVID's not their fault. To do the things necessary to stop the spread, that's what we can control. This is a plan that can do it. It's in partnership with our local school experts, and it's also data driven. And this is a plan that we think of looking across the world and here in the United States is the best one to give us an opportunity to get as many students the quality education they deserve. With that, let's start out. So I'll go front, Mary.
How feasible is this plan with 336 districts, 87 counties, a 5-part grid? Is this really something you can implement, and school districts might be changing throughout that grid constantly? It seems like a lot of math.
Yeah, it's a lot of work, and there's a lot to unpack for all of you who listen to this. The thing is COVID isn't easy. COVID doesn't care if this is hard work for us. COVID doesn't care how many school districts we have. We have to use the best data we have possible. We have to use that data and put it into a plan that works. We understand that if we can simplify and make it as easy as possible, there's people that would love to have just one statement. Yep, let's do this. Let's just go in. Or let's just stay out. We think that this is the best way to do it. So we do believe it's feasible. We do believe that we're going to be able to provide the support on testing. We do believe we're going to be able to provide the resources necessary. But I'm not kidding anyone. This is going to be really hard, just like distance learning was really hard. Is it going to be like another school year? It is not. But the alternative of leaving our children out of setting them back again and creating gaps in their education, or worse yet, putting them at a health risk is simply not acceptable. So we can do this. Tom?
Governor, this using the county level data per 10,000 population seems difficult to imagine how that would work in a county like Hennepin County, where the Minnetonka School District would be treated the same as Minneapolis, and then there's even smaller ones, Hopkins and others.
That's a starting point. And I want to be clear, this is where this can get a little confusing. Take, for example, Mankato. For those of you familiar with Mankato, I taught at Mankato West, as did Dr. Mueller. That sets, and our feeder schools were in Nicollet County in North Mankato. So if you look at that, the difference between Nicollet County's data and Blue Earth County data, the schools were split amongst that. This is not to look at it and say, yep, that's where we're at. These are the guideposts around health to be coupled with what the situation is in your community. And I think one of the things to keep in mind, we could get a situation that ratchets up to 20 to 30, but it may be a situation like we saw in Marshall and we saw in Austin, where it was tied to a business that was a place where we could get a handle on it and get relatively quickly. We could still, in theory, be able to operate our schools in that. So I want people to be clear. This guidance is not drawn in stone. And we understand that there's going to be a broader array of metrics that come forward. We just want the health data to be the starting point for the decision making.
If school was starting today, based on the data today, how many schools in Minnesota could open fully in person? Somebody have that figure?
We do have it. We will get it to you. And I think it's important to note that's as of today, as a snapshot in today, that we have those numbers as what they would look like. But the consultative process would require, once again, making sure those districts are ready to do that. Those that could, based solely on the health data that would be presented by the Minnesota Department of Health, that is going to be one number. Those that are actually able to execute it because of the age of their buildings and some of those things might be a little different.
The viewers who are watching now, is it? Does she have the figure?
We'll get it before we end here.
Or
Yeah.
can I follow up? Is there a sense of how many different districts are across how many different of those 5 different parts of the country?
Yes.
Do we have a ballpark of where?
There's a sense, but what you're both getting at is, and I'll just be very candid with you, where the fear that people would oversimplify that, they would see that and say, my school's back in, all is good. My school's not in, what am I going to do? It's not as simple as us saying this is where it's going to be, because we think that places that have tried to do that have failed because they haven't taken in all the nuances of the localized input to make sure that we're thinking deeper. And some of the stuff that Commissioner Malcolm talked about with Mike Ostrom talking is schools actually look a little different than, say, a business would look, just because of where the kids are, the spread, and the nature of the control of what you can do there. So we will give you that, but I would just ask, and you will do what you need to do. I would ask folks to be thoughtful about how you put that out, that this has already been decided. It has not been decided yet. It's simply a starting point to let folks say that you may have the potential to be back in person if you're able to meet these requirements. Our job is to help you provide the necessary resources to allow you to do that. Theo?
Some specific questions I'm getting. Pre-K, is it covered under this? Private schools, are they governed under this?
I'm going to let some of our folks. Commissioner, you want this one? Heather?
A whole bunch of things coming off there. Okay, so the question was whether or not private schools, and under the executive order, private schools are not covered in this. And so they will, however, be getting masks. And so that is one thing I think that's important to know. When we said all students and staff, we actually meant all students and staff throughout the state of Minnesota. But we did not talk about that for, this does not apply to private schools. In addition, private schools for our K-12, it does pre-K, I'm sorry, I need to back up. For pre-K, it actually does apply to pre-K and being thoughtful. Now, we've actually talked about it from a K-12 setting, and they are within the county. Would you like to continue? Okay.
Pre-K, it does apply to.
Pre-K is not included in these, but they are included in our county numbers. But it's not included in the plan. It's a K-12 plan.
Even if pre-K is provided by the district or part of the district?
It's strange because we're going back and forth here. So as we are thinking about our pre-K, they are included in our numbers and being thoughtful about whether or not we should be doing hybrid and whether or not we should be doing yes.
Following on, I wanted to ask, what is to prevent families from transferring their students, their children, to a district that is in person, given what they may find attractive about that? Are you getting confident that? Are you concerned about that?
I think one of the things is parents have always had those choices involved. I think what you're going to see here is, and it would be my hope, I go back to Theo's question. My guess is those private schools will follow this guidance because we've used the best epidemiological and the best research to do that. I think the question, if you want to bring this up, Commissioner, this gets brought up a lot of times. The one thing I would say before you speak, if I could just say on this, I can't imagine there's districts that are in a competition and saying, hey, we can get more students if we just go back full time, regardless of what the numbers show. I just know educators and parents well enough. That's not what they're going to do. I think the question might actually be the other way around, and that's why we have that. What if you're going back and your student has an underlying health condition? That's why we've written in this to make sure that you are guaranteed to have that distant learning. So,
Thank you, Governor. That was really well said. And thank you for your question. It has come up. Minnesota has had a long history of school options, right? With open enrollment, charter schools in communities. And so we know that our school communities, as they have been building out all three scenarios since June, are working very closely with their students and families for what those options can look like. The closer a school community works with their students and families to design in all three of those scenarios options that families are confident about and feel good about, the more likely they are going to have the opportunity of stabilizing that enrollment. And yet we do know and everyone understands that there are definitely options. And so our school communities are going to be working very closely, both to communicate what's been happening, to survey what it is they're looking forward to during this the beginning of the school year as well as the entire school year, and designing those plans with students and families and the safety and the talent of their staff in mind.
And yet we have a wide variety of communities, both those who are ideal or opposed to distance learning, and also parents and families that might be supporting the science but are still overwhelmed by the practical ramifications to their life. Is there anything in this plan that you appeal to your own personal experience, anything in this plan that gives specific support to families as they possibly approach another distance learning start of the school year? And speaking specifically of Minneapolis parents who are already in the record as that district looking like it will go to a distance learning model.
Yeah, thank you as well for that question. So I would say that one of the things we've committed to at the Department of Education is having a family-facing communication and support arm like never before, because we recognize we want to not only support our school districts and our charter schools like never before, we also want to make sure that we are supporting families and families know they can come to us for support. That means translating more materials than ever. That means making sure we are listening to families and students more than ever. And that being said, at the same time, knowing that we are supporting our districts and charter schools because families look to them first for everything. Our school communities have probably shared stories with you of families turning to them during this pandemic, asking questions about a whole range of things, not even just education questions. And so we've been collecting our own best practices to share out to families directly, as well as we see one of our roles as amplifying some of the best strategies out there for deeply meaningful family engagement, so that our families do not feel lost, like many of them were reporting they were feeling this past spring. So I'll give an example just from yesterday. The deputy commissioner and I had the opportunity to listen to a small group of superintendents, and one of them shared this family academy they were building specifically for that reason. They were going to host it at different times during the day. They were going to translate it into different languages. We see our responsibility then of taking that great idea and amplifying it so other schools in the state can benefit from that and do the same thing for their families, because they have such trusted relationships. Yep.
I just want to build on that point, Carla, because I think that it is the question, right? It is the question for families. This has been an incredibly emotional and difficult time for all of us. And as the governor and I are in, positions of elected leadership, first and foremost, we're parents, and I'm a mom. The conversations that we have had in our family, we have had about our daughter and her overall health. My daughter has asthma. We've talked to her doctor about what is best for her in order to make that decision. And we talked about developmentally, what does she need in this moment? And every family is going to have those hard conversations, but necessary conversations about weighing the risks. And I would just say that, we are a family that is very connected with our school district. St. Louis Park Public Schools has done a tremendous job of staying connected and in touch with families. And I know that district, our district, and other districts across the state take that very seriously, because that is the point. I certainly know that I can talk to the Commissioner of Education, but I really want to talk to Superintendent Osai and to her classroom teacher and to her principal about what is the best option for that school, but also for our family. So we're not saying that we have all the answers for individual families, but folks should be thoughtful and think about what's best for their child, what's best for their family, and that they have those choices. That was really important to us, that if parents decide they don't want to send their child back, that they have that option, because we know how overwhelming this can be.
Let me ask, the in-class part only works if the teachers show up, if they feel safe enough to show up. Have you gotten a sense that they feel safe with this approach? Because if they take leaves, if too many of them leave, you can't do what you're planning to do.
Yeah, and this is a great question. I want to appreciate all of you bringing this. This is what we knew going into this. No one had ever tried to do education on this scale in the middle of a global pandemic the way we're doing it. And there are so many scenarios. And the thing about it is each one of those scenarios matters really, it's the heart of those families, like Lieutenant Governor's talking about. That's their child. They want to get it right. This issue around teachers, you've seen some of the surveys that have gone out. I'll just have to tell you this, just anecdotally, I have spent some time calling and texting. I was texting this morning with a colleague who I taught and coached with in Mankato, and asked him what he thought. He said, I want to get back in the classroom, but I'll be honest with you, I'm nervous. I'm nervous for the kids. I'm nervous for us. And I asked, what would it help? He said, I'd like to know there's testing available. I'd like to know we're thinking about what the alternatives are. And I'd like to think that there's some protections there if something happens. What happens if we get sick? What happens to our workman's comp, whatever it might be? I think the thoughtfulness that went into this, that is a real concern. And the one thing I would say about this is, just like so many professions, when you go into teaching, you want to be in the classroom and teach kids. So their default position is to be there. Our job is to make sure that we put them in a safe space. So I'm concerned and think about this. It's tough to find subs as it is now. Substitute teachers is tough before COVID-19. We need people to see this as a profession to get in there, but it's something we're certainly monitoring. I have one clear back, Kevin.
Is there a ceiling beyond which you would make this mandatory? Right now you have 50 plus of 10,000 cases over 14 days. If you reach 200, would you declare this as a mandatory?
Yeah, and I think that's maybe one for Jan, that the health department still always has that responsibility. If we see an anomaly or something spreading very quickly, or we had an incident that led us to believe that it was going to spike, the health department still, as they always do in every public health situation, has the ability to go in and make those changes. I think what we're trying to do here, and there's no doubt about it, this is super nuanced. Not to try to make it super nuanced, but because we think it's the best way to engage as many people as possible to get this right. And so we're going to be working with them. I cannot imagine a scenario where a school district has 200 per 10,000 and says, we're going to school anyway, no matter what you say. At that point in time, the health department, much like they would in other situations, would simply say, that's not an acceptable answer. We have to go the other way. We don't think that will happen. Because it's in the best interest of that school district to get this right for the long haul.
Sure. Tom's question, which is, the city of Edina is one of the only places that keeps its own data. If you use their data right now, the city of Edina is below 20. Hennepin County is above 20. And what you're saying is Edina would have the discretion to go against what the county numbers are.
So, yes, they can always do more. And I want to be very clear about this. And I talked to Superintendent this morning, talked to Ed in Minneapolis, talked to superintendents across the state. But speaking with him, that he made this, they needed to make a decision, and I applaud them on this. They are the local leaders we're looking for. One of the things that we were, of course, concerned about is that we would put out data and say, oh, you're only at 19, you're not at 20. Why are we doing this? We're looking at trends in this data. This, again, Commissioner Malcolm's data that was showing up there and the data that we're putting out there is 2 weeks ago. So it's actually the 15th of July note. But yes, they have the discretion to think about where the trends are going, and that's why we went to the 14 days. But I think if Deputy Commissioner Mueller has some numbers for you, and I caution all of you to hear this. It's a moment in time. It's one of the metrics that can be used. And what we certainly didn't want to get into is they said, well, the governor says it's safe for you to go, and you've chosen to go distance learning. Or the governor said it's not safe for you to go, and you're doing this anyway. We wanted to avoid that with this consultative process, but I think asking the numbers, we'll give them to you. We're there today.
Sure. So just to quickly touch base, you asked the question about what it would look like for in-person, and we have approximately.
Yes, by today's numbers.
Yeah, so we can give you like what our approximate numbers are. So there would be approximately 181 districts in person. There would be approximately 230 districts with in-person elementary and hybrid for secondary. There would be approximately 107 with hybrid for both elementary and secondary. Approximately 7 with hybrid for elementary and distance learning for secondary. And there would be approximately 9 for distance learning for both.
Follow up to that, for the schools that do go in person or decide to go all distance learning, how will that impact fall athletics? Will schools be able to have people playing sports if you're not allowing them into a classroom?
This is one, and it's a great question, Tom. It's one that I've asked my team going into this. The high school league, and of course, working through Commissioner Tomes and our team that put together about how youth sports are operating right now. The Minnesota State High School League will come up with some of their requirements. This is what you're seeing in professional sports. So Marshall is getting ready to play Wilmer, and one of those two cities actually has an infection rate that has them distant learning. It'd be much like the Marlins. And I'm not going to make the decision on this. I'm going to leave the best science, the best data that's out there, and then those high school leagues and those athletic directors will determine that. It is our goal, again, to use that best data, what we've been doing over this summer. We have been seeing sports being played, and I think Jan maybe would tell you we have not seen a high level of transmission amongst those playing that, and I think that will impact their decision. This does not roll out into sports at this time, but the guidance that's around, especially the health side of it, will play a role in that.
School league to determine the best way to
as they start to look about how we're going to deal with that in consultation, much like we're doing with the school district, in consultation with the health department. I'll go Theo and then back here.
What date do districts have to make their decision by on the start?
This would be one I might leave to my education experts. It would probably be better because I think many, and this is for parents, I just want to be clear. This is when you're thinking about, do I need to shop for new gym shoes or is he going to be in the bathrobe all day at class, and I don't need to do it. Those are things we're asking at our house. And I think this is where this part about your local districts and what you heard the lieutenant governor say is, I look for the text from Joe Gothard in my house, and I am the governor, to say, what's Joe Gothard saying about St. Paul Public Schools? He's using the guidance we're putting out and operationalizing it. So.
Thank you for your question. Our expectation is that all of our school districts and charter schools will let their school communities know at least 1 week before they are starting their learning model. Now, to the earlier point about the constant communication, our school communities are going to work to let their students and families and staff know before that, but we do have an expectation that it is at least 1 week before their learning model starts.
If a district decides that 1 week out, is it going to be the district that gets to decide, or when that decision's sent up to you and the health regulators, do you guys make the final call? Who makes the final call, the district or you guys?
That is a district level decision in the consultative process. And so we are going to work alongside them. And I will say the critical thinking in your earlier questions about, Hennepin County is a big county. What about Minnetonka versus Minneapolis? The critical thinking in your question is exactly both sides of that equation. If we were to treat every school in the county the same way, then we wouldn't have equal numbers on each side of the equal sign, right? Which is what you're supposed to have. When you take the county level data rather than state level numbers, right? You localize what the virus is doing near you, and then you localize the health requirements you have the ability to act on and implement with integrity, right? As you saw Commissioner Malcolm talk about the ability to clean those high touch surfaces frequently, the ability to both create routines around hygiene as well as daily practice, the ability to have safe physical distancing. Those are definitely taken into consideration as well. And that's how you take Hennepin County and turn it into the localized approach so that Minnetonka's will have equal numbers on both sides of their equal sign, and Minneapolis will have equal numbers on both sides of their equal sign as well. And yeah, absolutely.
Outside the metro too, if we look at a map, they now have a map published out there that much of rural Minnesota would be in person, all students. I'm hearing directly from teachers in districts outside the metro who say their buildings are physically too small to social distance.
And that's the other side of the equal sign.
It's not that you're taking one.
Of course, yeah.
This is the fear of going to this. Yeah, that's exactly right. This was our fear of this, that people would say, look at the map and that's what's done. Each building looks different. Some of these rural districts have brand new buildings with brand new filtration. Some of them have facilities. I've been up like in St. Cloud at certain places. They have glass barriers that they can move and change the shape of that building. Those are the types of things that will have an impact. So again, I know this is hard. I caution folks from jumping ahead. This is where your local experts are going to be a role in this. It probably isn't surprising to many folks in here that it's going to look that way on county data in greater Minnesota. I'm going to do something that my communications team would never tell me to do. I'm going to anticipate your question on this. Why didn't we make this on every decision? Why didn't we do this on every decision on businesses and things like that? Because the school environment is uniquely different and the transmission rates on the health are much different. That's the reason for that. But it does come back to that point I've been making through this whole COVID situation. As we learn more and we get better at controlling the transmission and we get better at identifying who spreads it faster or where it might be, that can influence how we can go about making some of these decisions. Nothing that's done is cast in stone. I think it's important each of these folks said that. This is the start point for this conversation about education with the goals of the safety of those students and the staff in the building, and to the best of our ability to get those students back in. The reason we want so badly to get them back in the classroom is because all of the evidence shows that's the best place for learning to happen in the relationships. And that's what we all want. We can't though just say, go back and discredit some of that. So you're right on. In this one amongst all, there are probably 10,000 different scenarios, but I would come back to this. That scenario for that individual family matters. So that's why the thought of trying to build in some flexibility, some data-driven, localized decision-making. Yes.
Compliance. Who's going to enforce all of this, I guess? What if the district isn't following the necessary guidelines? Is there a phone line for?
This is not all that unusual about how they cover other things. Again, I will never make the comparison. COVID is not influenza. We have things in place with the Department of Health when they make that, but guidelines of enforcing graduation standards or whatever they might be. So Commissioner, I don't know.
Deputy Commissioner Mueller and I can tag team this one. So first, I will say this approach, this localized data-driven approach grounded in the science, is actually created to protect our school communities from the virus, right? So actually the virus is the worst case scenario of this. So as far as compliance goes, the work we do at the Department of Education is really to keep the virus, to help support our school communities to keep the virus out of their school communities, right? Because that's the worst case scenario. That's the worst thing. And this is also why we have this consultative process. We have incredible expertise out there in our school leaders who have years of experience in running their charter schools, running their school districts, and we are all learning together how to manage a teaching and learning environment during a pandemic. This consultative process actually means that the support comes first And compliance becomes a question at first. What is it about the importance of physical distancing you don't understand yet, right? Like, how can we better support you in understanding the importance of physical distancing? And actually, in this case, in the dozens and dozens of conversations I've had with charter school leaders and superintendents, they actually feel like they're one step ahead. They're already thinking incredibly creatively. The ingenuity is absolutely incredible. I talked to a superintendent this morning who already has an agreement with the American Legion down the street for their band to practice in because it's 5 times the size of their band room, right? And I could give you a list. Deputy Commissioner Mueller could give you a list of the incredible ingenuity out there, which made so yes, is there a point where I have to say, no, really the science says that this is why masking is effective? Absolutely, we're ready to do that. But there is so much camaraderie already, and they are so far ahead in trying to figure out these accommodations that they have a deep understanding that the virus is what we're fighting here. It is not compliance.
Ingenuity. What are you going to do with, say, I'm a 7-year-old, my parents are cops. Right now I'm being shipped to a daycare center. But during the school year, they're going to go to work, and I'm going to be at home on a day of online learning. What are we going to do with the 7-year-old kid who has no severe vision?
So we have been really intentional to ensure that folks have access to childcare throughout the pandemic. And so for any family who is in that kind of position, it's important that they visit mn.gov/childcare to find local childcare in their area that's available. But also, if there are families who are struggling to pay for childcare, that is, there's an opportunity for folks to also apply for the Child Care Assistance Program. So there's more folks who are working on the issue of childcare than ever before, and that's a perfect place for folks to go for guidance.
Follow up, specific question on that from a viewer. What about a single parent who has to work full time, but child has an underlying health condition and they can't send them to child care or to school? Is there any plan to help the parents who cannot work due to child?
So they can stay home. They can stay home and get additional assistance. We are not forcing people as a family member with an underlying condition to go back to work. That continues to be something that we're supporting.
Kevin, since we're winding down, can we switch topics for one second? Sure. The president has spoken about some things in recent days that have tremendous impact on states. One is the idea of delaying the election. The other is the idea of surging federal, I don't know if you want to call them forces, police. I want to get your reaction to those two things. Have you heard any communication from the federal government that they're considering bringing those federal forces into Minnesota?
We have not. What I would like them to do is focus on getting us back in schools. They told us they wanted us to do, and that's what we're doing. I'd like them to focus on testing shortages, which they told us to do in the testing, and now they're starting to divert some of those. And I think most of us know, again, I have stayed out of these public battles on this, but I am a member of Congress, and I do know that only Congress sets elections. And if there is not an election before January, then Speaker Pelosi becomes the president. My assumption is that was not the plan in that. But I think this issue of distracting us from what's on Minnesotans' minds, right now, it's about how do we get our kids back in school and stay safe? How do we keep our economy open? How do we pay the rent? And so here in Minnesota, I'm going to stay focused like a laser on making those things happen. I will express that I wish we had more federal help, but as I've said from the outset of this, we can't count on someone else to do this for us. That's why we built a robust testing structure. That's why we've used our experts who are here. And that's why we as a community and as a state have crafted a get back to school plan that, yeah, it looks like none other. And I would have never imagined in a million years, whether I was a teacher, a parent, or the governor of Minnesota, that I would be involved in trying to figure out how to get kids back in the classroom. But that's the hand we've dealt. And the good news is Minnesotans take those hands and turn them into something good. We can do this. I would just today, as we wrap up, I know you've been patient. You've taken a lot with us of listening. This is a lot to unpack. There's hundreds of pages of guidance for those school districts, but these are professionals who care about your children. They are the ones who took that little guy's hand when I dropped him off at Bridges School, took his hand and took him in that school and changed his world. That's what is available here. We'll get this right. Wear the masks. wash your hands, try and social distance. Let's get our kids back in there. Let's be flexible to try and get this right, knowing that we want to protect those children. We want to protect those staff in that building, and we want to protect the families who have these issues that they come up. But we can do this. We've been thoughtful about it, but I'll tell you this. We are flexible, just like you saw Dr. Mueller. If the slides don't work, we move to the next one. If that doesn't work, we move to the next one. We are going to maintain flexibility. We are building for depth to get us through this entire school year. And I think we get this right. I think the country gets this thing right. We get this vaccine and we get these kids through this school year, and we have some really, really great kindergarten graduations, some really, really great proms, and we get folks there. That's our goal, that we're at this, and Commissioner Ricker's right. We're not in this, and again, we've said it all along. We don't ever want to issue a ticket for anything. We want to give you a mask. We want to get you healthy. We want to stay out of your business and make sure we're taking care of your kids that you've entrusted us to, and we give them a quality education so they can live a great life. This is the start of this conversation. It's July 30th. A lot will change between now and September 8th. I would ask all of you to change what you can change in this. Let's stop community spread. Let's get this thing ready. Let's communicate with our local schools, and let's make this work. Thanks, Minnesota. Thanks, commissioners. Lieutenant Governor, thank you.